All right, so TEG. So TEG stands for what?
Thromboelastography.
Yeah, thromboelastography. Okay, so now don't quote me, I don't know the numbers off the top of my head, but there's a few things we look at. So it's here, 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 basically. This is in a nutshell. So the first thing is the R time, okay? And that, if prolonged, correlates with needing FFP, okay? Then the angle here is gonna correlate with needing cryo, okay? And then this is the MA, or the maximal amplitude, and that's gonna correlate with platelets. And then lysis over here is going to correlate with whether we should do TXA. Okay, so tranexamic acid. Why do we give tranexamic acid to trauma patients that come in that are bleeding to death, say?
Stabilizes the bleed.
Yeah, so it's inhibiting lysis of the clot, right? That's the whole idea. So again, your body is in this constant homeostasis of clotting versus not clotting, right? So that's like somebody who has, tell me all the components of Virchow's triad.
Stasis.
Yeah, so stasis, hypercoagulability, yeah, and endothelial damage, right? And again, what applies to a trauma patient? Pretty much all of them, right? So that's why putting a patient on chemoprophylaxis that's a trauma patient is quintessential, right? You guys are probably sick of me saying it, but it's just so important, right? That everybody's on. They're just so high risk for DVT-PE, okay? Does that help? Yeah? So again, we get the TEG, and then we also have platelet mapping too, which is helpful. And then a good question the other day, we had a patient who had a brain injury who was an end-stage renal disease patient. So they have chronic renal failure. They're on hemodialysis. What is a good thing to think about to give them kind of almost like prophylactically? What's not going to work really well in those patients? Their platelets. Why is that? Yeah, their high BUN, their uremia causes platelet dysfunction. So what's good to give them kind of prophylactically? Yeah, so we like to give them DDAVP. So that's going to express von Willebrand factor in the endothelium and help clotting. So I like to kind of just give that prophylactically. We talked about that the other day in an end-stage renal patient with a bad traumatic brain injury.